Dilapan-S is an osmotic hygroscopic dilator made of Aquacryl hydrogel. It expands by osmosis, absorbing fluid from the cervical tissue, resulting in reversible dehydration and softening of the cervix. According to clinical research, the optimum time for Dilapan to be in situ is around 12 to 15 hours.
Once the dilators are removed, a clinician will become available to break the waters. Once the waters have been broken, we will encourage mums to mobilise for a period of time to see if the labour will establish on its own. If this doesn't happen, an oxytocin infusion will need to be started to augment labour. Dilators are made in a length to make sure they go through the internal os, which is the inside of the cervix. However, they're rounded and they soften very quickly, so they're not going to cause any trauma to the baby or the cervical tissue. They are also unlikely to break the waters because of that reason, but if they do, it's absolutely fine because they can stay in situ for 12 hours post-rupture.
It's really important that you insert them correctly, and that will ensure that they don't fall out. When you insert them, just ensure that you insert them through both the external and the internal os. And when you remove them, just gently pull at the strings and they will be removed with ease.
One of the benefits of Dilapan-S is it doesn't contain any pharmacological agents, so we're not concerned about it causing uterine contractions. And so women can get up and move around straight away and continue with their daily activities as they would. It also means for this reason that it's perfect for outpatient regimes because it's got a minimal risk of causing any adverse events. One of the major benefits of Dilapan-S is that mums can just continue with their daily activities as they would. They can have a shower and go to toilet as usual. We do have to say to mums to avoid a bath and avoid sexual intercourse. Also, under no circumstances should she remove the dilators herself. She should report to her clinician if there's any pain, bleeding or any change of fetal movements. No, so we say that 95% of women are reporting that actually the procedure is fully acceptable. The diameter of dilators are so small that as they're put in situ, the cervix tissue slowly stretches around them. It is licensed for ruptured membranes. However, we would say to be careful of aseptic technique, use a speculum insertion and also possibly use aseptic solution on the cervix on insertion.